Hi, I'm Matt Welch for Reason TV. I'm here in Las Vegas at FreedomFest. I'm joined today by John Goodman. He's the author of Priceless. Thanks for joining us, John.
Glad to be with you.
Curing the healthcare crisis. Let's get to first definitions here. What is our healthcare crisis right now as you define it?
Well, the problem is we have so completely suppressed the marketplace in healthcare that none of us ever sees a real price for anything. No patient, no doctor, no employer, no employee. And because of that, we're all facing perverse incentives. And when we act on those perverse incentives, we make costs higher, quality lower, access more difficult, and we create all of the problems that we're having.
What's an example of the quality being lowered, just to throw one out there?
Well, on the provider side, the incentives for doctors, hospital administrators, and others is to maximize against reimbursement formulas, to get as much money as you can out of the payment formulas of Medicare, Medicaid, Blue Cross, employer plans. And so when the providers are doing that, they're not putting us first, they're putting that payment formula first. And when they do that, they're not providing us with optimal care.
So let's go through some of the solutions. What are these market-oriented solutions? What could they do? How could we do?
We need to empower patients. We need to free doctors, basically liberate the marketplace so that patients and doctors are free to solve their own problems. Right now, they're not.
How does that happen? What are the mechanics of freeing them up?
We need a liberal health savings account that can wrap around any third-party payment plan so that people can manage more of their own health care dollars. Basically, all preventive care, all diagnostic tests ought to be paid for by patients from their own health savings account. But even the chronically ill can manage a lot of their own money, and they can do so very successfully, and we ought to allow them to do it.
Are we thinking about healthcare wrong? Is there some fundamental mistake with the way that most Americans or most policymakers think about healthcare as a policy question?
Well, both on the right and the left, there's one huge mistake everybody is making, and that is the thought that the way you make healthcare accessible is you make it free at the point of delivery. When we do that, we forget that if people don't pay with money, they'll pay with something else, and primarily they're paying with time. But those non-price barriers to care are more important in deterring access than the fee the doctor charges.
You look around the world, it's not a monolithic system out there for the provision of health care. What is a country or a system that is doing interesting things that we might learn from?
South Africa is an interesting country. In the private marketplace, more than half the account of the insurance there is health savings account insurance. So they have a much more liberal use of health savings accounts and patients controlling their own dollars. Singapore is sort of interesting. It's had a MediSave account, which is their version of a health savings account, since 1984. And then Switzerland is one of the few, about the only other developed country that has a mainly private system. They mandate private insurance, but people own their own insurance. It's portable. It travels with them from job to job. So you can find interesting things going on, but you're not going to find a real market in any of these countries.
How important is it to break the link between your employer and your health insurance?
I don't know that that's all that important, but I think portable insurance is really important. So your employer ought to be able to pay premiums for insurance that you own and you can take with you when you leave the job.
In the wake of now the Obamacare ruling, and that's when your book came out, so congratulations on all that. How important is it in your scheme that Obamacare get repealed? Or do you think that's actually a possibility regardless of who wins?
Well, Obamacare either needs to be repealed or it needs to be hugely altered. One way or the other, we need to move from this top-down regulatory approach to healthcare to one that liberates doctors, patients, and other people in the system.
That's great. Well, thank you very much for joining us, John Goodman. Again, the name of the book is Priceless, Curing the Healthcare Crisis. For Reason TV, I'm Matt.